Before I go into this presentation, I must say that this exercise, this initiative, is extremely refreshing. I mean, personally for me, that I run the association, which is very much involved in daily stuff, burning issues, access to innovation, clinical trials, etc., and suddenly, here comes this project that talks in a way about fundamentals, that we need to talk to physicians, we need to talk to patients, because what we provide is cure, is medicine. And without these interactions, this dialogue, it will never happen. And Richard set the tone, set the landscape, talking about trust, and I think it's absolutely critical. And we, as the association, we need to implement. So in a way, a decision has been done by CEOs, and what we're trying to do is to do our best to make it happen. But as I said, this very intense contacts with physicians, medical world, scientific associations, patient groups, we've never done it before to such an extent. And I think it's itself, it's a value, I think. And I also believe that it may itself change the perception of the industry, of the association, because we have to do this. And on top of that, I also strongly believe this initiative is in the public interest. It's not just the industry interest; it's a public interest. So, I mean, basically, it's as it was said in 2013, EFPIA implemented a code. We had to implement it. And right now, we are in the process, I mean, roughly speaking, very intense education of the medical world. And to start, we thought, well, we had some, intuitively, let's say, some imaginations, what would be the perception of physicians, but we thought, let's start with some survey, some qualitative study to see what really physicians think about this initiative. And maybe I go to the second slide. It was conducted in February, so it was far before we actually disseminated the knowledge, this initiative among public, and in particular among physicians. We focused on physicians that cooperate with the industry on a regular basis, the specialists. So there were in-depth interviews, and then there were forums, inline medical forums that were coordinated, run by the research company. And basically, this survey confirmed what we had thought before. At one hand, on a, let's say, declarative level, the physicians say it's a good initiative, especially in the long run. It may indeed improve the transparency. It may indeed improve also reputation and trust towards the cooperation between the industry and medical professions. At the same time, this survey revealed, I would say, a big anxiety associated with this exposure. The exposure of names of doctors associated with sum of money of transfers of values. So I'm afraid you can't read it, but I put here some examples, some quotations of physicians, what they were saying, and there were some, I would say a whole spectrum. There's a very, I would say, positive responses, I would say more or less neutral, a very much negative. Maybe I'll start with negative. The code will be introduced at our expense. The industry will improve its reputation at the expense of the medical society. I think this is a very, very vital, very important feedback we received. Again, this is a qualitative. It's not. I mean, it's not quantitative. It's a very small but in-depth interviews. There was some like, without the support of pharmaceutical companies, we would have very limited access to all kinds of conferences and congresses. There were some very, I would say, positive. The introduction of the code will show the actual level of cooperation between companies of doctors and thus eliminate harmful opinions, etc. So I think for a start, it also, it is important to guide us what should be our next steps and activities. And needless to say, we had to engage in education, and a very intense education. At the same time, and this is relatively new, the Ministry of Health came up with an initiative, it's a bill, amendment of law on national regional consultants, medical consultants, to actually impose that transparency, not to disclose the transfers of values, but to disclose the conflict of interest, and that according to this legislation, which is in the process of public consultations now, the physicians will be obliged to disclose this conflict of interest, and not just with the industry. I mean, in general, with commercial entities, be it insurance companies, private hospitals, pharma companies, etc. And so they will have to disclose, and the data will be publicly available at the MOH website. So, in a way, you may say that there's a wave coming in the world, in the Western Europe, but also in this part of Europe. There's some measures, legislative measures taken to make this cooperation, interaction more transparent. So again, not to take much time out of you, we definitely, what we're doing right now, it's a really very intense outreach. I am personally meeting with the presidents of scientific associations. We attend congresses. We talk about the code. We have very good regular interaction with the National Chamber of Physicians, and what we see, what we hear from the feedback is basically what was in the survey. I mean, most of them are very much pragmatic. I mean, they say, look, I mean, this is going to happen anyway. I mean, it's happening in the world. This is going to be a standard. We are aware of this, and we'll have to simply to catch up. At the same time, I mean, and this is I would say, the very sensitive thing, the exposure. They will be exposed on a company website, a name and the transfers of values, and this, I think, this is what they have to cope with. We have to cope with, and we have to explain, and we have to convince that it's going to happen anyway. I mean, in the world. So I think as the self-regulation, I think we can also show that we are determined to make it happen. Also, we had some interaction in the press already, and I must say in general that the perception of the external world is positive. I mean, be it nurses, we spoke with nurses, with pharmacists, positive. NGOs that fight corruption, positive. Experts, positive. So I would say it's a very, very encouraging response, including some public authorities that we approached. But as it was mentioned in the previous presentation, after all, it all depends on the consent. That's the center of this. This is the, voluntary consent of a medical profession to disclose. And I think that's the beauty of this project, that we have to engage, and we have to explain and educate, and simply we have to work together. As I said in the beginning of my brief presentation, this is probably the most refreshing experience that I have working for the industry. Thank you.